Okay, so continue with the wrist. Moving on more into the hand. Um, we have the second row of carpals, and the second row of carpals just past the scaphoid, which sits just at the base of the thumb. We have the trapezium, and then moving more medial to that, we have the we have the trapezoid, and then right in the center, which I kind of think it takes a central role in our hand, but also is called the capitate, which goes along with, being the captain of those wrist articulations and wrist bones. So right in the center is the capitate. And then the bone that kind of splits between our fourth and our fifth, so our ring finger and our pinky finger, is the hamate. And you can kind of remember it's got a hook on it, and that's called the hook of the hamate. So that right there has some significance in our articulations of some of our ligaments and some of our tendons going across the wrist. And then last, we have that triquetrum that we talked about in articulations of the wrist, but also the pisiform that sits right on top of it. And if you take kind of your pincher fingers right at the base of your pinky, down at the wrist, you can kind of feel it's like a little pebble, and you can feel and almost move and um, glide that pisiform right there on the triquetrum. Okay, so then the anatomy of the rest of our hand, we have our metacarpals that make up our palm area. So you can see how when we have wrestling athletes, even boxing, or softball, baseball athletes that might catch a ball at the palm of their hand, maybe barehanded, that these bones can get very injured. Our boxing athletes, right? The fifth metacarpal fracture is called a boxer's fracture for the reason of the pinky kind of leading a punch um, in our boxing athletes, whether it's padded or we have an athlete or patient who punches a wall or a hard surface that they're not supposed to. So called a boxer's fracture. All five fingers have metacarpals, and then into our fingers, right? Our thumb is a little different. It only has a proximal and a distal phalanx, whereas our other four have proximal, middle, and distal. And at those articulations, right, mainly flexion and extension, they don't go into very far into extension. But at the MCP, the PIP, and the DIP, all of those joints have individual ligaments that keep them from moving side to side and help maintain their stability. So, what is important to remember is that our thumb is one of the joints that has a high prevalence, 100% prevalence of a sesamoid bone. We have a sesamoid bone also in our big toe, and the most popular one is our patella, right? So, this sesamoid bone helps with the extra articulation. It helps that our thumb can do particular movements. If you are a fan of video gaming, this sesamoid bone would helps with the ability to push those buttons and have as much dexterity as it does. So it's very important. But our other fingers have some prevalence of a sesamoid bone, particularly our pinky has about a 53% chance of having that sesamoid bone at the MCP joint. So it helps kind of protect the tendon, gives us a mechanical advantage by holding the tendon a little further away, so we have a larger lever arm. So you can see where that might be very important in the thumb. As much as we use the thumb for grabbing and really playing sports, but also our everyday life things. So some of the important soft tissue in our hand, I think it's important to understand that there's a large amount of fascia going on in each finger and throughout the hand. It's very dense fascia because of the restrictions we need, specifically in the palm. But um, so in the picture on the right, you can kind of see then the abductor pollicis muscles, the flexor pollicis, anything with a pollicis along with it is very much associated to the thumb. This is similar in our foot when we learned about some of the foot musculatures. But to kind of summarize what they do, they're often named for their function, right? So flexors are going to flex our fingers, abductors are going to abduct our fingers, spread them out. And then our extenders, we have our extensor muscles that extend the fingers so that we can get a wide palm. So I think it's important that you use the verbiage. Digiti is our digits, where pollicis is our thumb. But just knowing, for the most part, the words and how they associate to each finger, and in the movements that are necessary, can really guide you to where they might be located. So make sure that you're really reading what the muscle is in order to understand what it does. So finally, I just wanted to talk a little bit about the assignment I have for you guys. It's mainly going to be hand and wrist palpations. So palpating the different bones, because there's not much to do in the elbow, right? We have a few specific palpation points, but I really wanted to focus on the wrist and hand because it can often be misunderstood. So there's a list that I would like you guys to look over. If you need to look them up, you need to review them, Google them, whatever you need to do to understand where all of these are located and how to identify them. And then I want you guys to get together and quiz each other on the list, right? So have each other go through it, ask the questions, where are they located, maybe even what they do, if that is appropriate, or what attaches in these areas. So it's a good anatomy review, and then I want you to be able to physically identify the location, and then also have someone else quiz you outside of the two of you. I want you to have possibly a preceptor or an upper level student or even a graduate assistant that might be at your clinical site watch over you and quiz you on these palpations as well. So you're going to have those two people help you identify the structures, make notes, have them sign, and then you scan them in and turn them in. That's all you're going to do for the week as assignments go. So please let me know if you have any questions. I would be happy to talk through them with you and answer them. And I hope you have a great week, and we'll talk to you soon.